Welcome to this audiovisual notes on apnea of prematurity. Here, we will discuss this condition affecting premature infants, its causes, symptoms, diagnosis, and management. Introduction to apnea of prematurity. Apnea of prematurity is a common condition seen in preterm infants, particularly those born before 37 weeks of gestation. It is characterized by recurrent episodes of cessation of breathing, known as apnea. These apnea episodes can be accompanied by bradycardia, slowing of the heart rate, and oxygen desaturation, low oxygen levels in the blood. Types of apnea. There are three main types of apnea that can occur in premature infants. Obstructive apnea. This type of apnea occurs when there is a blockage or obstruction in the airway, preventing air from flowing into the lungs. Central apnea. In central apnea, the brain fails to send the proper signals to the respiratory muscles, leading to a cessation of breathing. Mixed apnea. This type combines features of both obstructive and central apnea, where the apnea episode begins with a central component and is followed by an obstructive component. Causes of apnea of prematurity. Several factors contribute to the development of apnea in premature infants. 1. Immaturity of the respiratory control center. The brain centers responsible for regulating breathing patterns are not fully developed in premature infants, leading to apnea episodes. 2. Underdeveloped respiratory muscles. Premature infants have weaker respiratory muscles, making it more difficult to maintain adequate breathing. 3. Airway instability. Premature infants may have immature airway structures, leading to increased airway resistance and collapse, which can contribute to apnea episodes. 4. Immature respiratory drive. The respiratory drive, which is the body's natural urge to breathe, is not fully developed in preterm infants, leading to periods of apnea. 5. Other medical conditions. Certain medical conditions, such as respiratory distress syndrome, intraventricular hemorrhage, and sepsis, can increase the risk of apnea in premature infants. Symptoms of apnea of prematurity. The primary symptom of apnea of prematurity is the cessation of breathing for a prolonged period, typically lasting more than 20 seconds. Other symptoms may include 1. Bradycardia, a slowing of the heart rate, often accompanying apnea episodes. 2. Oxygen desaturation, a decrease in the oxygen levels in the blood, which can cause the infant to appear pale or bluish in color. 3. Cyanosis, a bluish discoloration of the skin, lips, and nail beds due to low oxygen levels in the blood. 4. Periodic breathing, a pattern of breathing characterized by periods of shallow or irregular breathing, alternating with periods of apnea. Diagnosis of apnea of prematurity. Apnea of prematurity is typically diagnosed through continuous monitoring of the infant's breathing patterns, heart rate, and oxygen saturation levels. This monitoring is often done in the neonatal intensive care unit, NICU, using specialized equipment, such as 1. Cardiorespiratory monitors. These devices measure the infant's heart rate, respiratory rate, and oxygen saturation levels. 2. Apnea monitors. These monitors detect apnea episodes and alert healthcare professionals when an episode occurs. 3. Pulse oximeters. These devices measure the oxygen saturation levels in the blood by clipping onto the infant's foot or hand. In addition to monitoring, healthcare professionals may also perform diagnostic tests to rule out other potential causes of apnea, such as brain abnormalities or respiratory infections. Management of apnea of prematurity. The management of apnea of prematurity involves a combination of different approaches, depending on the severity and underlying causes of the condition. Some common management strategies include: 1. Gentle tactile stimulation. Rubbing the infant's back or feet can sometimes help stimulate breathing and terminate an apnea episode. 2. Positional therapy. Positioning the infant on their side or stomach can sometimes improve breathing patterns and reduce apnea episodes. 3. Oxygen supplementation. Providing supplemental oxygen can help maintain adequate oxygen levels during apnea episodes and prevent complications. 4. Continuous positive airway pressure. PAP. This non-invasive ventilation method can help keep the airways open and improve breathing patterns. 5. Medications. In some cases, medications such as caffeine or respiratory stimulants may be prescribed to promote regular breathing patterns. 6. Mechanical ventilation. In severe cases of apnea of prematurity, mechanical ventilation may be necessary to support the infant's breathing until the condition resolves. Prevention and long-term outcomes. While apnea of prematurity is a common condition in preterm infants, there are several strategies that can help prevent or minimize its occurrence. 1. Antenatal corticosteroids. Administering corticosteroids to the mother before preterm delivery can help promote lung maturation in the fetus, reducing the risk of respiratory problems, including apnea. 2. Kangaroo care. Skin-to-skin contact between the infant and the parent, also known as kangaroo care, has been shown to promote better respiratory stability and reduce the incidence of apnea episodes. 3. Adequate nutrition and growth. Ensuring that preterm infants receive appropriate nutrition and achieve adequate growth can help support their overall development, including respiratory maturation. Most infants with apnea of prematurity outgrow the condition as their respiratory control centers and respiratory muscles mature. However, in some cases, apnea of prematurity can be associated with long-term neurodevelopmental issues, such as developmental delays or learning difficulties. Regular follow-up and monitoring by healthcare professionals are essential to address any potential long-term consequences. Conclusion. Apnea of prematurity is a common condition affecting preterm infants, characterized by recurrent episodes of cessation of breathing. While it can be a concerning issue, proper monitoring, management, and preventive strategies can help minimize the impact of this condition and support the infant's overall health and development. By understanding the causes, symptoms, and management approaches, healthcare professionals and families can work together to provide the best possible care for these vulnerable infants.